Hello, Uganda. Mwanguzi Shadrach from Health Touch Uganda. Today I'm going to be talking about abdominal bloating. This is described by different people in different ways. Some people call it abdominal fullness. Others say I have gas in my stomach or in my abdomen. Others say I feel full. But it is all the same thing, and I'll be using these terms interchangeably: abdominal bloating, or having a lot of gas in your abdomen. I'll be talking about what causes it, some of the things you feel in conjunction with this bloating. I'll emphasize those warning features that if you get any of them, you should go to a health facility and seek medical attention. I also talk about some of the things that you can do at home to prevent and treat abdominal bloating. So abdominal bloating, like people call it having gas, it is caused by gas, having gas in your abdomen. And we get this gas when we are eating, we swallow it, or when part of the food that has not been properly broken down is converted into gas. Someone would say, why is it that other people get the gas and others don't? Some people, when eating, they swallow a lot of gas as compared to others, especially the people that eat and drink very fast, the people that smoke, the people that commonly chew gum, those that drink using straws are all at an increased risk of swallowing more gas than the rest of the people. Then there are people who are intolerant to certain types of foods, to the point that those foods are not going to be broken down well. There are those who have a lot of gas-forming bacteria, the point that when you eat food, because these bacteria are many, you are going to form a lot of gas. In some people, they have underlying medical conditions, and it's these medical conditions that result into excess gas formation. So, which other symptoms or which other things accompany bloating or abdominal bloating? Some people start feeling pain in the abdomen. Others start belching, okube jagala in the local language. Others start feeling those rumbling sounds or the abnormal sounds in the tummy. They can really be disturbing when you're in public and all of a sudden your belly or your stomach or your tummy is rumbling. So what are some of the things that should warn you and probably make you go to a health facility as soon as possible? If on top of your abdominal bloating, you also feel a lot of abdominal pain, to the point that you can't even settle, you don't want to move, you don't want to shift or change position, it's important you go to a health facility. If you experience a heartburn, severe heartburn, you feel fire in your chest, you also go to a health facility. Some people start vomiting, others start passing out blood in their stool or passing dark colored stool. Others start having fevers. Others experience unexplained weight loss. All of a sudden you realize you're losing weight. So all those things are supposed to make you go to a health facility and seek medical attention. What are some of the things that you can do at home just in case you experience that? If you're someone who is overweight, I will humbly request that you reduce on that weight, because it might be one of the reasons you get that occasional abdominal bloating. If you're someone who eats and drinks very fast, you can reduce on the speed of eating and drinking. When you're drinking, please drink from the cup, from the container direct. Don't use a straw. If you're someone who usually smokes, it will also be important that you cut on the smoking. If possible, stop, because abdominal bloating is just a mild symptom of the vast complications that can happen due to smoking. But today I'm saying if you experience abdominal bloating, you might want to reduce on your level of smoking. There are people who get the bloating after eating certain foods. So if you've identified these foods, it will also be better that you reduce or even stop eating such foods. Some of the common foods are dry beans. People who eat dry beans most of the times end up with rumbling. So if you can get the fresh ones or even another form of sauce, the better. There are those who are just sensitive to certain foods. There is what we call lactose intolerant. There are foods, especially the milk products, foods which have milk as part of them, they contain lactose unless if they have removed that component of lactose. So if you're lactose intolerant, it also be important that you read on the nutrition table on those different foods and ensure the food doesn't have lactose. If you can reduce on the amount of carbonated drinks that you take, still you can know a carbonated drink after reading on the nutrition table attached on that particular food, on that particular drink. Because in some people, every time they take these carbonated drinks, that's when they get the abdominal bloating. Mwanguzi Shadrach, Health Touch Uganda, follow the light.